Merhabalar, hoş geldiniz. Bugün çok değerli bir üniversitemizin çok değerli akademisyenlerini ve yetkililerini sizlerle birlikte bir araya getirmekten çok mutluyuz. Southampton Üniversitesi, İngiltere'deki, Birleşik Krallık'taki en iyi üniversitelerden bir tanesi. Özellikle de Psikoloji Departmanı çok değerli, başarı sıralamalarında da çok yüksek yerlerde. Southampton Psikoloji Departmanı'ndan bugün Dr. Theresa Allen ve Dr. Emma Palmer Cooper'ı ağırlıyoruz. Aynı zamanda Uluslararası Ofis'ten meslektaşımız Rami El Musa bizimle birlikte olacak. Ben öncelikle çok kısa da olsa kendimden bahsetmek istiyorum. Daha sonra da Southampton ile birlikteliğimizin nereden kaynaklandığı ile ilgili de çok kısa bilgi aktarmak istiyorum. İsmim Sevda Öncelbat, BEB British Education Büro'nun kurucusuyum. Aynı zamanda eğitim direktörüyüm şirketimizin. Gazi Üniversitesi mezunuyum. Akabininde Oxford Brookes Üniversitesi'nde master'ımı tamamladım. Peki BEB kimdir? BEB British Education Büro açılımı, Southampton Üniversitesi'nin Türkiye'deki resmi temsilciliğini yapan bir kurum. Temsil ettiğimiz üniversitelerimizin Türkiye'de tanıtımına destek veriyoruz. Üniversitelerimiz için organizasyonlar gerçekleştiriyoruz. Bugünkü organizasyon gibi. Akademisyenlerimizi ağırlıyoruz. Üniversitelerimize başvuru yapmak isteyen öğrencilerimize A'dan Z'ye başvuru sürecinde destek oluyoruz. 2002 yılında Oxford'da kurulduk. İngiliz ve Türk kuruculara sahip bir yapımız var bizim. 19 yıldır da İstanbul, Ankara ve İzmir'deki ofislerimizde öğrencilerimize hizmet sunuyoruz. Uzmanlık alanımız İngiliz eğitim sistemi. Üniversitelerin giriş şartları, başvuru sürecini yönetmek gibi süreçler bizim uzmanlığımız. Tüm danışman kadromuz bizim İngiliz eğitim sistemine vakıf, bu konuda eğitimler alan ve hala da almaya devam eden bir kadrodan oluşuyor. Birleşik Krallık'ta 130 tane üniversite vardır. BEB, bu üniversitelerin 90'ının Türkiye'de resmi temsilciliğini yapan bir kurum. Resmi temsilciliğini yaptığımız kurumlar için de ücretsiz hizmet sağlıyoruz. Benim söyleyeceklerim çok kısaydı. Çok kısa kendimi tanıtmak istedim. Ben şimdi sözü üniversite yetkililerimize aktarmak istiyorum. Bizlere bu numaralardan da sorularınız olursa her zaman ulaşabilirsiniz. Aynı zamanda sunumun sonunda da arzu ederseniz chat box'ta sorularınız varsa sorularınızı yazabilirsiniz. El kaldırma butonu var. Arzu ederseniz sesli sorabilirsiniz sorularınızı. Sunum sonrası, ortası da olabilir, sonrası da olabilir. Nasıl arzu ederseniz sorularınıza yanıt vermekten mutluluk duyarız akabininde. Ben şimdi sözü Rami'ye bırakıyorum. Rami, over to you now.
Thank you very much, Sevda, for the introduction. Thank you, BEB, for all the hard work, as always, very professional and very active in promoting Southampton. I'd like to introduce today two of my colleagues who are going to be talking about the faculty, the School of Psychology. Dr. Emma Palmer is a lecturer in psychology within the Center for Innovation and will be giving us a short talk today about mental health. And Dr. Theresa Allen, who is our program director for our MSc programs and the academic director of the doctoral program in clinical psychology within the psychology department. My name is Rami El Musa, obviously, as I mentioned. I work for the international office, and I'm usually the first contact person within the university students. So I would usually meet you face to face, either in one of Sevda's offices or in educational fairs. But obviously, this year it's been different due to the pandemic. I hope you and your families are well and safe, and I wish you all a happy Eid, which should be in the next couple of days if you're celebrating. So over to Emma. Emma, if you'd like to share your screen and start your presentation. We would obviously take questions towards the end, and Imran and Sevda will be assisting us with that. So thank you everyone for attending, and over to you, Emma. Thank you.
Thank you. So hopefully everybody can see my slides and everyone can hear me. So yeah, I'm Dr. Emma Palmer-Cooper. I'm part of the Centre for Innovation in Mental Health, which is one of the labs, the research labs that are part of the School of Psychology. So I am a research psychologist and my interest lies in mental health. So, and I'm one of the supervisors for our master's students and our clinical psychology students. So I'm just going to be talking a little bit about an introduction to mental health, ways that we can think about it, and the way that we like to think about it in some of our research in the Centre for Innovation in Mental Health, and give some examples of the types of things that we look at and that we teach about, and drawing on a bit of research that I do myself in the department. So firstly, what is mental health? So we can think about mental health as a spectrum of experience from the positive to the negative, and rather than being you're either in a state of good mental health or a state of bad mental health, you can sit anywhere along the spectrum. And everyone will inhabit different areas or different parts of the spectrum at different stages in their life, but everybody sort of strives to inhabit the this end, so kind of excelling and thriving, and we would consider people to be potentially not very well if they're struggling or in crisis. But poor mental health is often referred to in textbooks as a mental disorder or the study of abnormal psychology. And this is something that we're trying to move away from, because it sort of implies, when we talk about abnormal behavior, thoughts and feelings, it implies that mental health is this other experience that is bad and that it's quite negative, rather than it being a normal experience that lots of people have, and we just happen to move up and down this spectrum. So people often consider mental health to be a departure from the norm, but we try not to think about mental health in that way in our teaching and our research. But at its worst, poor mental health can indicate that someone is experiencing a mental health problem. So we need to try and understand why what experiences are normal and everybody has them, and or many people have them, and what experiences may indicate that somebody is well. So I asked a number of students before what is normal, and this really highlights, this word cloud really highlights that lots of people think about normal in different ways. So thinking about mental health as sort of normal or not normal is essentially, it doesn't work for everybody, because we all have different ways of experiencing normal. So we think about normality in other contexts. So the average height in the UK for men is 5'9" and women is 5'3". But if a man was 6'6", we might consider this to be unusual, but it's not bad. And so we try and think about, again, these sort of mental health experiences as they might be unusual, but they're not inherently a bad thing. They're just not necessarily typical. So for example, in the NBA, the average height of players is 6'6", and so this, in that context, this height is very normal. And so again, in certain contexts, the way that we're feeling is actually very normal. So we're just trying to kind of highlight that we don't like to think about mental health as being abnormal. So the World Health Organization defines mental health as a state of well-being in which every individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and they're able to make a contribution to their own community. So we think it's better to think about mental health or poor mental health as being maladaptive. So people, it's not a helpful way of reacting to a particular situation. It interferes with people's ability to lead a productive life. And most importantly, it's related to distress or discomfort. So this is how we kind of frame mental health in a lot of the way that we teach and research in Southampton. So we then need to understand what counts as poor mental health. When do we need to worry about somebody's experiences in the way that they're behaving? So if we first take depression, if we look at the diagnostic criteria for depression, it is defined as a persistent feeling of sadness and hopelessness and a loss of interest in activities that were once enjoyed. So it's a massive change from the way a person was functioning, and very sort of persistent feelings of sadness and also hopelessness. It also involve a number of physical symptoms, so things like aches and pains, flu-like symptoms, changes in energy and appetite, changes in sleeping ability. So we really need to understand that depression is not the simple feeling of sadness. It is this sort of all-encompassing feeling of sadness, but also there's a lot of physical symptoms that come along with it. But 5 or more symptoms need to be present for at least 2 weeks for a person to be diagnosed with depression. We think about mood in the general population. Feeling sad is a very normal experience, so we cannot diagnose somebody with a mental health problem if they're just feeling sad. We need to have more information and more symptoms than low mood. And feeling worried is also a very normal experience. So worrying about sort of a number of situations is very, very normal. We wouldn't want to potentially diagnose anybody with anything if they're worrying about a normal experience. And feeling stressed as well is a very normal experience. This is something that a lot of students will experience when we come to exam time. And it's a very normal experience that, most people will have at some point in their life. These are all just normal responses to unpleasant situations. So we need to make sure we understand the difference between these very normal feelings and experiences that everybody has and when this might indicate a mental health problem. So if we then take psychosis, which is another very serious mental health problem. Psychosis is a mixture of different symptoms. Some of them are positive, so things like hallucinations, so hearing voices or seeing things that other people can't. Also delusions such as paranoia or exaggerated or distorted perceptions, unusual beliefs and behaviours associated with this. And also often psychosis can be presenting as disordered speech, so people making up words, they speak in a way that doesn't make sense, they jumble a lot of words together. So this is what a person with psychosis might be experiencing. They can also experience negative symptoms, which is a loss or decrease in the ability to do normal behaviours, to speak, to express emotion or find pleasure. So psychosis is a very serious mental health problem, and people will need to have a number of these symptoms for quite a long time to be diagnosed with psychosis. There's also disorganized symptoms where people behave confused and disordered in their thinking and their speech. They might have trouble with logical thinking, and sometimes this leads to bizarre behaviour or strange movements. So this is what psychosis might look like. But many people associate psychosis with hallucinations. And so then when a person might have a hallucination, in the absence of any other symptoms, they might start to get worried. But actually hallucinations are quite common. And again, they're quite a normal experience for people to have. So research from about 10 years ago showed that up to 10% of the general population have heard voices at some point in their life. So it's not a huge amount of people, but it's still quite a large number of people who have had this experience. So it's more common than people think. So it's unusual, but it's not rare. So again, if 10% of the world's population have blue eyes, so hopefully that kind of puts things into perspective. It's unusual, but it's definitely not rare. More other research has shown that up to nearly 38% of people have experienced hallucinations of some kind in their life. So not just hearing voices, hearing, seeing, feeling, smelling, or tasting. So actually having some kind of hallucination is really quite common. And again, in France, nearly a quarter of people have blonde or light brown hair. And so again, that hopefully highlights actually how common this experience is in the population. So some research that we're doing in the department at the moment is looking at phantom phone signals. So this is a modern and really common phenomenon, and it's where people experience the sensation that their mobile phone is vibrating or ringing or making a notification sound when actually it's not. Some research has gone into this, and over half of young people who were between 12 and 14 years old have had this experience. And this was published a couple of years ago. And in some research we're doing in the department at the moment, we found again over half of our undergraduate students have had this experience at some point in the last few years. So again, this is just highlighting that these experiences, whilst they might seem unusual, are actually quite common. So we need to really make sure that we're able to distinguish as mental health professionals and as researchers what the difference is between an experience everyone has and something that might indicate somebody is experiencing a mental health problem. So in terms of hallucinations, when hearing sounds or voices that doesn't have a clear source becomes really distressing, either due to what the voices or sounds are saying, what they sound like, or indeed how often they're happening, we might consider this to be a sign of mental health problems like psychosis. But if somebody is just having these experiences and isn't upset by them, then we wouldn't consider it to be necessarily a clinical problem. So if we just look at how common mental health problems are, at least 1 in 4 people will experience some kind of mental health difficulty in their life. So again, it's really quite a common experience. And if we look at mood disorders, so mainly depression, about 18% of the population will experience some kind of mood disorder in their life. So that's 1 in 5 people. So again, it's really quite common. And it's not unusual, but it's also not a rare experience. So we then go to schizophrenia or psychotic illnesses. About 1% of the population will have these. So if we contrast this to over half of young adolescents will have had a hallucination, hopefully that just highlights that actually, whilst psychosis is quite a rare type of mental health problem, having some of these experiences is actually really normal. So we need to move away from thinking about psychosis as being directly related to hallucinations. So psychosis is quite rare. So hopefully I've demonstrated examples of poor mental health represent experiences people have that are maladaptive. They interfere with their life and ability to lead a productive life, and they're related to distress or discomfort. So mental ill health isn't abnormal. In fact, actually, generally having a mental health problem is a fairly common experience in the general population. And it's the combination of experiences and distress that make this an experience related to mental health or not related to mental health. So generally, the things that we research and that we study in our department is about how to treat poor mental health. First, we then, like I said, need to decide if it's an experience that needs to be treated. So if low mood isn't prolonged or it's not affecting a person's life, such as a couple of weeks of feeling low after breaking up with a partner, it might not need treatment. We need to follow this person up and see if the mood need is sort of prolonged. Again, with hallucinations, if someone is having a hallucination but isn't distressed, it wouldn't require any treatment. If a person did meet diagnostic criteria for a mental health problem, we would usually treat them with a combination of medication to reduce symptoms, and that would usually be with a medical doctor, and then psychological therapy as well. And this is something that we do a lot of research in our department, and it addresses cognitive, emotional, and behavioural symptoms, and the most common is cognitive behavioural therapy, but also family psychoeducation, so trying to give family and close friends the psychological tools to support a person who isn't well. And again, this is something that we're interested in our department, and we do some research and train people in how to use some of these techniques. So that's just that's me. If you have any questions, please do ask either about the research or about the course, where I can direct you to raise instead. Thank you.
Lovely, thank you very much. The The mute button is always an issue. I don't know why, but anyways, thank you very much, Emma, for the lovely presentation. I'm going to be talking a little bit about the university as a whole, as an institution at Southampton, and then Teresa will be talking a little bit more about the other psychology programs that we offer at an MSc level. So just to talk a little bit about Southampton, obviously, as you may have seen, Dr. Emma, Dr. Cooper, who's just mentioned that we do a lot of research as an institution, and that means that Southampton is part of an elite group of universities called the Russell Group. But just before talking about the university, Southampton, we're located on the south coast, so not too far from London, if you've been to the UK, and considered to be one of the greenest cities in the UK. I used to live up north in Manchester and further, and it's pretty dull and grim. Whereas in the south, I should have moved to Southampton a long, long time ago. It's considered to be one of the UK's sunniest cities. We have 26,000 students, 400 from 30% out from outside the UK, more than 140 nationalities. So our reputation as a whole, we're a founding member of the Russell Group Universities, so the top 24 research institutions in the UK. We're ranked top 20 in the UK and top 100 in the world. Obviously, Sevda has worked very closely with us with placing some very high quality students, especially sponsored from the Ministry of National Education. So we have a very good reputation in Turkey as well. 49 students from Turkey, including 10 UG, 15 PGT and 24. I think majority of them have been advised and helped by BEB. There are excellent staff who know so much about Southampton and can give you lots of information about Southampton. And we have many subjects that students come for from Turkey, but specifically psychology. I mean, we currently now have 2 students who are studying their PhDs with us, and we're looking to have not less, I think, than 7 or 8 new postgraduate students who are joining us this year. So we're very popular, and due to the fact that we offer a wide range of courses, such as health and the MSc in clinical foundations psychology. Multi-campus, Southampton has 7 campuses, 6 of them in the UK, and we have a campus in Malaysia. Main campus is the Highfield campus where our students will be studying, and we have a global presence pretty much everywhere you can think in the world, whether in Turkey, whether in Europe, Southeast Asia, the Americas. We either have an agreement or we have an exchange program, a split-side PhD agreement, a memorandum of understanding, and many, many other ways of working with universities worldwide. So we have a very international reach. Our campus, Southampton main campus, obviously this is a photo of our lovely campus in the sun. And this is where majority of students study their programs. Student support, our support to you as a student, and this is part of what I do at the International Office. We offer students scholarships. So if your grades are equivalent to a first, to an excellent GPA, you may qualify for up to £3,000 scholarship. But that information you'd also need to check with me. I can forward that to the faculty and see if you qualify for some type of scholarship. So if you feel your grades are high enough, by all means, please do check with me, and I can run it by the faculty and see if you qualify for a scholarship. Supporting you, enabling services. Obviously, we support our students who have any issues such as disability, mental health problems, specific learning difficulties. We have workshops to manage stress, anxiety, exam preparation. We have a personal academic tutor. Obviously, Emma did mention that she helps assist students, so she may be a personal tutor for maybe 1 or 2 or a group of students. We have many other services as well that we support students with. Halls of residence accommodation is guaranteed for the full duration of the course on the university campus, whether you're coming for an undergraduate program or a postgraduate program or a PhD. And the accommodation is available. We have more than 7,000 rooms for students. And these are just a few photos as well of the accommodations available. So single room, single bedrooms, common areas where you share a kitchen, and you get a free bus pass as well from the university if you join university accommodation. 24-hour security. You have catered and self-catered options. Obviously, it'll be better to stick to your own food because you may not come back to your accommodation at specific times when food is served. So there's lots of restaurants, cafes, bars available all over the university, all over the city. A map as well of the university accommodations, showing you that it's all linked to the Uni-Link bus at the university. So you get a free bus pass. You join the once you join university accommodations. Careers destinations, very important department where we link you with major employers. We don't guarantee jobs, but as you're aware, there's a study visa route scheme where students are allowed to stay in the UK for up to 2 years after they graduate. And you don't really need to have a job. So if you'd like to stay in the UK for 2 years after you graduate a new degree, look for a job or live in the UK, that has been permitted from this year, actually from last year. So any student who joined us last year, September, and is joining us this year, September, has that opportunity to join the graduate visa route where you're allowed to stay in the UK, which is very attractive. We're targeted by top graduate employers who come looking for our students. And we have a careers fair that happens every year. Obviously, this year it was online, it was a virtual fair, but still employers managed to speak to many of our students. Apart from the academics, life on campus, we have, as you would expect from a university campus environment, we offer so many facilities for our students. And we have an 8.5 million sports complex, 300 clubs and societies, and we even have a 360-seat cinema. So we offer our students a lot of activities, a lot of options as well. These are some examples of the clubs and societies. We pretty much have every club and society you can think of. I did come across the other day a belly dancing society, if anyone's interested. But other than that, we have every single club and society you can think of. Cake decorating. There's Turkish society, obviously, which is very active, and they gather together and have a lot of meetings with them. So there's lots of clubs and societies you can join at the university. The city itself, obviously, is one of the top 3 cities to live in Britain. Close to London, you're not paying London prices, but there's many videos that I think you should have a look on YouTube and online to see for yourself what a lovely city Southampton is. If you're into sports as well and sailing, we're on the waterfront, so students can get the opportunity to get involved in those type of sports. If you watch football, good news is we're in the Premier League, so you can watch the major teams coming to Southampton every single week, and you can get involved in sports. But then if you're interested in other types of activities, the lovely waterfront, the New Forest, and the Isle of Wight, which is 20 minutes away from Southampton. So as a city, it has so much to offer and really a beautiful place, and the weather is incredible as well. Things to do, obviously this is a new built complex that has been built in the city centre, and you can see in the winter period, Christmas time, there's an ice skating rink where students, well, everyone gets involved. not for me really. I failed maybe 100 or more times, so I've decided that I'm not going to try it this year in order to remain safe and not break any ribs. Connecting with us, obviously, as you may know, we've been connecting with lots of students through webinars. We connect through similar activities with BEB, and at the same time we connect students with our academics and current students. So one example is we have 2 students now who are studying psychology, PhD students, and they have kindly agreed to help any students from Turkey interested in studying psychology or asking any questions really about psychology. So please do get in touch if that's something that you'd like me to do. In addition to that, we offer a service called Uni Buddy, where students can speak to academics who teach on a specific course. If you just Google University of Southampton Uni Buddy, you'd find that information online. We're on all social engines, so have a look wherever we are: Facebook, YouTube, and WhatsApp, and many other social media engines. My contacts, obviously, this is who I am, and there's some important contacts if you have any visa queries, or if you would like to know how the university has been dealing with COVID. The news coronavirus applicants page gives you information about what exactly is currently happening. But on a separate note to that, today the Vice Chancellor has announced that we are going back to business as usual, and we are receiving returning students. Students are returning to us hopefully by the 17th of this month of May, and come September, we're expecting business as usual for students and face-to-face interaction. We had minimum online interaction. Obviously, we were never a university that offered online degrees, but when we were forced to close at the beginning of the year, we did offer online options and virtual options.
Lots of our teaching is delivered by external National Health Service lecturers, and that's wonderful because they're on the front line. They're keeping up to date with all the latest cognitive therapy developments and so on. They've got latest case examples to discuss with you, and all the teaching on the MSc Foundations of Clinical Psychology is workshop based. The MSc isn't a professional training program, but it is recognised by the British Psychological Society as counting towards continued professional development, which is the highest level of recognition I could get for it. And during this program, it's like getting 2 MSCs for one, because you actually get training in advanced research skills as well. Let's move on. Okay, so in semester 1, there's a combination of advanced research skills training and then clinical teaching, and you're going to get thorough coverage of cognitive behaviour therapy for adults when working with people with anxiety and depression. You'll learn basic therapeutic skills in counselling and motivational interviewing, and you'll learn about more advanced cognitive behaviour therapy, the 3rd waves, which is including dialectical behaviour therapy, acceptance and commitment therapy, and mindfulness. And what I really like about the programme is that all the assessments are really related to the teaching materials and all really clinical. So, for example, when you're learning your fundamentals of therapeutic skills, the assessment is looking at you doing a video recording of yourself actually doing therapy with somebody. And another advantage of this MSc is that actually we've been able to adapt it online, because NHS clinicians have been delivering therapy online, and I think that is going to be the way forward. There'll still be face-to-face work, but actually in the NHS you can see way more people if you're not having to travel far to see them. You can fit them in at different times of the day. So in semester 2, we have a really unique module which has done students very well when they're thinking about employability, because we look at leadership and management. We teach people to recognise what skills they have, what's the difference between leadership and management, how do they work in teams, and how can they cope with change. And the MSc has a global mental health focus, which really comes to the fore in the module called Fundamentals of Clinical Psychology. I'm interested in whether Western models of mental health can be applied cross-culturally. Should we be doing that? Can CBT be adapted? What can we learn from other cultures? And there is so much that we can learn. And I think students find that really enjoyable, that module. And because a third of the cohort are international, we're learning about people's experiences from all over the world. People in Zambia, Antigua, Pakistan, India, Saudi Arabia, Australia, Canada, they're all there and they can all give their own input. And of course, Turkey. So you also get the chance to do a dissertation with one of, having supervision from some of the really internationally renowned experts in the department, because it's a Russell Group university. It attracts top talent. So you're working on that from kind of like the first week of the program. We get you thinking about your ideas. And what can you go on to do after it? Well, UK students have gone on possibly to do the doctorate in clinical psychology. I've had other students who are international who've gone on to study for professional training in America and in the Lebanon. Students have actually managed to gain jobs as psychological wellbeing practitioners, and that has not been limited to UK students. Or they've got jobs as assistant psychologists or honorary assistant psychologists. Others have gone off to work in charities. I've had others people working with charities in Egypt and all over the world, working with asylum seekers and refugees and anybody who needs help. And others, of course, have gone on to do PhDs. And Nesli and Irem, who are our current 2 Turkish PhD students, are all graduates from the MSc Foundations of Clinical Psychology. So there's a lot of options for you. Okay, so now whistle stop tour. Let's move on to the MSc in the health psychology. And this is part 1 of a potential 3-year professional training program. Unfortunately, you'd have to move to another university to do part 2. But it's really looking at how can you promote and maintain health? It's not about just treating ill health. And how can you prevent people from getting ill in the first place? And they're looking at the etiology and other factors that really link to health and illness. And it trains you to actually influence policy making and decision making, which is a really advanced skill to have. Oh, Fliss Bishop, the program director, has listed various things about why you should choose Southampton. But again, it's because her course, because it is part 1 of a professional training program, is actually accredited by the British Psychological Society. You've got the option to choose different modules. You have some core ones that you have to do, but other ones are really, you can choose exactly what you like. Just let me look at my piece of paper where I'd written down what some of these are, because I don't know that program off the top of my head, although I should do by now. So there's modules on the psychosocial aspects of health, the psychosocial aspects of illness and disability, psychology in the delivery of health care, the role of psychologists in health promotion and designing and delivering health and illness related interventions. There's so many wonderful things. And yeah, there's a lot of support on that program, whether it's from your peers through a journal club or your personal academic tutor or the program team. It's a much bigger program team for the MSc Foundations, and they're all really involved in research. So this again is just showing the different modules that you have during semester 1 and semester 2. And the important thing is to note that you also get the advanced research skills training in this program, and you get to do the dissertation as well. And where did these graduates go on to? Well, some go on to work in universities doing further research or doing PhDs. Others maybe work in specialist hospital or medical activities. 71%, which is a pretty good figure, went directly into employment. And I think the remaining just were actually taking time out, which is why they didn't go directly into employment, or they went on to further study. And for the jobs that people went into, 30%, it was a formal requirement, but the majority of students said it actually conferred an advantage when to obtaining their current role. Okay, so that's the whistle stop tour of health psychology. Now, MSc Research Methods in Psychology. This is for you if you absolutely love stats, or if you've struggled a bit with stats and would really like to improve so that you show that you've got the potential to study statistics at a postgraduate level, which might be important if you do want to get onto a professional training doctorate and you haven't had such good stats grades. So the aim is to equip you with a wide range of quite advanced methodological and stats skills so that you could become a successful PhD student or a professional researcher. But there's actually a variety of things you could go into. I might mention that at the end. So in the first semester, you'll be taking some of the same modules as the MSc Health Psychology and MSc Foundations. We were looking at qualitative methods in particular, how to plan and design research, concepts and skills needed to think about research, and statistical programming in R. I am not too familiar with that, but I know it's been an alternative to the statistical package for the social sciences and is the way forward. And in semester 2, you're going to look at how to work with groups, looking at correlational methods, and you look at advanced statistical methods in psychology. And you can do a research apprenticeship in psychology where you actually get to work in one of the labs with one of our lovely researchers. And in summer, of course, you do the dissertation. Oh, that's the end of my PowerPoint. So I need to come back here and stop sharing my screen. Hang on. I'm always terrible at finding out where my screen has gone to. So this could be that you just get to share a black screen for the rest of your life. Hang on, I don't know what is going on here. I can see that's something that's saying meeting controls, but it's not allowing me to do it. Okay, so stop share. Ta-da! Apologies. I managed it in the end. So very happy to take any questions.
Yeah, thanks, Teresa. Thanks, Emma. Senda, over to you and Imran. If you have any specific questions, I can see there are questions in the chat box. If you'd like to run through them, obviously there are ones that are straightforward, which possibly you and Imran can answer, but the ones that are more specific to Teresa and Emma, it would be great if we can get them across. Thank you.
Yes. Yes, thank you. Thank you, Emma. Thank you, Teresa. It was great. There are a couple of questions for Emma because it came straight after her presentation. Emma, please go ahead. Thank you.
Yeah, sure. Thank you for your questions. So one question, the consumption of marijuana might affect developing of schizophrenia. Is this true? And is there any outside effects like this is in any psychosis? Yes, there is a lot of evidence to show that if people are already at risk of developing schizophrenia or psychosis, if they also then consume marijuana at a younger age, they're much more likely to develop psychosis or schizophrenia again, and typically that ends up being a few years earlier than the average age. But it also is related to the type of marijuana that people smoke. So if there's more THC, which is the psychedelic, then that puts people at more risk. Whereas if there's more CBD compared to THC, then some research has shown it's not a risk. So yes, there is some links. It's a bit complicated, but in essence, yeah, there is a link. Another question, hallucinations without distress don't require treatment. Do you think a hallucination can be problematic even if it doesn't cause stress for the person? Certainly, yeah, if they interfere with people's lives, if they're very distracting, if people, if people still find them irritating or they're getting in the way, then certainly you could still seek treatment. The main thing is distress if people are unhappy that they're having them. But there are actually quite a lot of people who have hallucinations quite regularly, who either aren't distracted by them or actually enjoy them. So it really is a very subjective experience as to whether people find them unpleasant or want to remove them. But yeah, that is possible. And then another question was, if an individual is not facing the consequences of their disorders, then treatment has negative impacts, whether or not it's needed. Yeah, so sometimes if people aren't aware that their symptoms are related to an illness, that can cause problems. But again, this kind of comes down to whether they're disruptive, they're upsetting, they're causing issues for the person to live their life. Usually, if it's not, then we wouldn't suggest treatment. And I think that was all of the questions from my talk. So thank you very much for the questions.
Thank you. Yes, we can ask more questions.
I think so. There was a question about scholarships. Obviously, if you have a GPA GPA of a 3.3, you would qualify, well, if you have an equivalent to an excellent GPA, I think, which is possibly 3.3 and above in some Turkish universities, you'd qualify for a £3,000 scholarship. If you have an equivalent to a very good GPA, you would qualify for a £2,000 scholarship for your degree. So £2,000 and £3,000 are available depending on how high or how good your grades are. Then you could always email your transcripts through to me, to Imran at BEB, and we can advise if you would qualify for a scholarship or not. Does anyone have any other questions you'd like to ask? Any specific questions you have about the degree, about Southampton as a city, or about our courses? Now is the opportunity for that. Alternatively, obviously, we can always put you in direct contact with students that are studying on the course. Teresa may have been involved with students, and yeah. If there's anything you feel you want to know, please do ask BEB. Obviously, they've been brilliant in advising students, not only to Southampton, but pretty much all over the UK. So they can help you with finding the right option for yourselves. So we will give it a few more minutes. Sure, go ahead.
Sorry, Rami. Yes, there are some questions coming through. Okay, great. Burcu Hanım sormak ister misiniz? Buyurun lütfen.
Öncelikle size merhaba. Hi to everyone. Thank you for good presentations. It excited me up very much. Thank you. I want to ask something about the career destinations mentioned in the presentation. There was something like doctorate in clinical psychology and some other thing, PhD student. Is it different in UK, doctorate in clinical psychology or PhD in clinical psychology? Does this mean that doctorate is directed towards practice about making therapy, and the other one is for clinical psychology researches? Is that true? The two things are different, I think. Doctorate in clinical psychology and PhD.
Okay, so in the UK, if you want to become a professional trained clinical psychologist doing therapy, you have to take a 3-year doctorate in clinical psychology. For example, at the University of Southampton, we offer a 3-year program. In the first year, people learn about working with adults and older adults and have all the teaching related to that. And it covers neuropsychology, health psychology, different therapies. In the second year, they learn about child and adolescent mental health and working with people with intellectual disabilities. And in the third year, they learn about professional practice and advanced therapy skills. And throughout those 3 years, in parallel with the teaching, they're on placements in NHS hospitals. So that is the professional training route. It's also at a PhD level, so it's at a doctoral level, but the professional training to become a professional clinical psychologist is a doctorate in clinical psychology. Now, you can also go on and study for a PhD. I've actually got a PhD in clinical psychology research, as well as being a clinical psychologist. And that would be another, that's a 3 years program. You could start off, I think, Rami, you're ever so good at knowing about 1+2 things at the University of Southampton, where you could do a master's level first and then go on for an extra 2 years to do something. So you might need to say more than that.
The other question is about the entry requirements for the clinical psychology master degree. Teresa, would you like
Okay, yes, yeah, I know what they are. Yeah, so I'm looking for a degree of at least a 2-1 level. So Rami will have to translate that for me into Turkish qualifications. And I really look to see if people have got at least 2-1 levels in each of their statistics grades. Because the program teaches skills, it's really helpful for students to have some experience of working in a mental health setting. And I also am looking for people who are interested in global mental health.
So a 2-1 is usually equivalent to a 2.7 GPA and above. So around that mark, we usually accept students. Usually the grading, the rating of their degree has to be a very good rating. So sometimes, you know, when you get your certificate, you graduate, it says so-and-so has graduated from the university, rating is very good. That usually is an indication and equivalent to 2-1. Obviously, a first, which is an excellent GPA, differs from one university from another in Turkey. Some of them start at 3.3, maybe 3.4, going up to 3.65 and 3.7 out of 4. So it all depends really on the university that they're attending. But I must say that we get excellent students, excellent quality, and all very keen on psychology, which is what we really want.
We also have an IELTS requirement for the standard of English. So we require an overall score of at least 7 with no individual score falling below 6.5.
Mm-hmm. That's correct. And to add to that, if you have studied, if you're at a university and your degree has been taught and assessed in English language, then you would be exempt from providing an IELTS letter in order for your offer to become unconditional. So you need to you've been taught and assessed, and it has only a 2-year duration. So if you're starting in September 2021, you would have had graduated within a 2-year period, and then we can accept that. But then you would have to run that through by us, by the faculty, in order to get a confirmation.
Thank you. Those are all the questions so far I can read up. So a couple of more seconds to give students, maybe they have other questions. Sorry about the background, the noise. It's very hard to be with the kids in the big house. It's lockdown in Turkey. I'm sure people who have kids will understand us. Okay, well, I think that's it. I would like to thank you, Dr. Ellen, Dr. Palmer Cooper, dear Rami, thank you very much for today. It was great pleasure having you and listening to all those very useful information. Thank you very much.
Thank you for inviting me.
Thank you for having us. And please, yeah, do get in touch. Obviously, Sevda, me, you, and Imran will follow up on this. And yeah, I wish you all a great Eid, and hope to see you very soon.
Yes, stay well.
Çok teşekkür ediyoruz katılımınız, ayırdığınız vakit için. Bu vesileyle Ramazan bayramınızı da kutlamak isteriz. Sevgiler, saygılar, iyi akşamlar. Hoşça kalın. Bye bye.
Thank you.
Bye.
Bye.
Bye.
Bye.